Hello, everyone. My name is Javiani Giustiniano. I am currently enrolled in the summer course ECCE 1105 at Chattahoochee Tech with Miss Abercrombie. Today is June 15th, 2025, and I will be discussing the management of injuries and acute illnesses as an educator. This topic is incredibly important because as early childhood educators, we are often the first responders when a child gets hurt or becomes ill. Being prepared means knowing how to act quickly, responsibly, and confidently in medical emergencies. Our role is not only to teach and nurture, but also to protect and respond when a child's health or safety is at risk. My references will be the sources found in Health, Safety, and Nutrition for the Young Child by Lynn Marotz and articles on the American Academy of Pediatrics site, www.publications.aap.org. First, we'll be talking about how to respond to medical emergencies. Medical emergencies in a childcare setting can happen at any time. Chapter 9, Section 1 in the textbook emphasizes the importance of preparedness, quick assessment, and calm response. The American Academy of Pediatrics recommends all caregivers be trained in pediatric CPR and first aid and maintain emergency contact information for each child. Educators should also have a written emergency plan in place. This includes knowing who contacts 911, who tends to the child, and who communicates with the family. Preparation prevents panic, helps ensure that the child gets the care that they need as fast as possible. Now we'll be moving on to the difference between emergency care and first aid. It is crucial to understand the difference between emergency care and first aid. Emergency care is required when the child's condition is life-threatening or could result in permanent harm without immediate intervention. This includes situations like not breathing, bleeding heavily, or unconsciousness. First aid, on the other hand, is used for more common non-life-threatening injuries such as scrapes, minor burns, or insect bites. While these may not be emergencies, they still require attention and proper care to prevent infection and ease the child's discomfort. The textbook stresses that all educators should be trained in both emergency and first aid care because both are likely to be needed at some point in a child care setting. Next, I'll be expanding upon life-threatening conditions. Chapter 9, Section 3 covers conditions like choking, severe allergic reactions such as anaphylaxis, seizures, and shock. For example, if a child is choking and unable to breathe, every second counts. Educators must be trained in the Heimlich maneuver and know when to start CPR. Children with known allergies may carry EpiPens. It is the educator's responsibility to know how to use them and understand the child's allergy care plan. According to the AAP, prompt use of an EpiPen can be life-saving and should never be delayed while waiting for emergency services to arrive. Now, I'll be discussing non-life-threatening conditions. Non-life-threatening conditions can include fevers, sprains, nosebleeds, and minor cuts. While not immediately dangerous, these conditions still need to be managed with care and attention. For example, if a child has a fever, educators must know how to monitor their temperature and when to notify the parents. The textbook emphasizes the importance of documenting all injuries and illnesses, no matter how minor, and communicating with families so they are aware of what happened and how it was managed. This builds trust and ensures continuity of care once the child goes home. In closing, managing injuries and acute illnesses is not just a requirement, it is a core responsibility of any childhood educator. Being prepared, trained, and confident in responding to both emergency and routine health issues ensures that every child is protected in our care. By using trusted resources like Health, Safety, and Nutrition for the Young Child and the American Academy of Pediatrics, educators can stay informed and ready to act when it matters most. Remember, children depend on us, not just for learning, but for life-saving care in moments of crisis. Thank you.